Hello, everybody, and welcome to another episode of Dentistry Beyond the Numbers. These are one of those interviews. No, this is the one interview or two or three in my lifetime that I would do. Let's call it a discussion that keeps you up at night, wants to make sure you are perfect and you are where you are, because I've been looking forward to this for so long. And without further ado, I just want to introduce Dr. Gordon Christensen. Doc, thank you so much for joining us at Dentistry Beyond the Numbers. And we're going to establish, go ahead, I'm sorry.
Mark, I'm delighted to have the opportunity. You have a large group of people who are listening, and I'll share some experiences, good and bad.
Great.
Yeah.
I just want to tell people, for those of you, and I know that you must be under a rock, but this is a man that has been a mentor from a distance for everyone for the last 45, 50 years, and maybe longer. We're going to talk about that, but I'm going to talk about a couple of stories personally about some of the things Dr. Christensen did. But I wanted to say that, we're about everything, clinical profit margins and everything like that. But Dr. Christensen is one of the most influential figures in modern dentistry, a pillar of education for over, I calculated, 60 years maybe. I mean, since he started that.
More than that.
Unbelievable. He is eternal, a true Mount Rushmore in dentistry, and he really is. I'm honored to have Dr. Christensen. For those of you who may not be as familiar as I am, though I doubt there are many, Dr. Christensen is the founder of Practical Clinical Courses, co-founder and senior consultant of Clinicians Report Foundation, which it was phenomenal through my upbringing as a dentist and a practicing prosthodontist, with more than, and he says a lot more than 45,000 hours of continuing education that he presented, thousands of research publications. We know that, a career spanning decades. He shaped the way a lot of us practice today. But beyond the accolades, Dr. Christensen has dedicated his life to one mission: providing unbiased, evidence-based education to help dentists deliver the best possible care to their patients. Today, I'm going to dive into his journey, his thoughts, and where dentistry is headed, what bothers him, and how do we navigate better. No way we can fit a career like this in just 20 to 30 minutes, but please bear with me. We're going to definitely try, everybody. Welcome, Dr. Christensen. I am pumped, but sorry. That's
Thanks, Mark. It's my pleasure.
No, I love that. Thank you. So let me ask you from the beginning. We have a lot of young dentists that listen. What inspired you about dentistry?
What did or does?
We're going to get into what does, but what did? Years ago, what made you become a dentist back then?
My ecclesiastical leader, I happen to be an LDS person, and my ecclesiastical leader was a mentor, was a dentist. He was a very altruistic man. He would give you the shirt off his back. I could see he lived in a beautiful house. He had a beautiful family. It was a perfect life. And I thought, I was accepted any way I wanted to go: engineering, medicine, dentistry. And this man inspired me. He had a life that included just about everything I was seeking: family, a religion, a altruistic attitude, and that he did it.
That's great. And did he you went to USC, right, I believe?
Yeah.
Did he go to USC, or did you?
No. I didn't even know any dental schools at that point. My family was relatively uneducated. My dad had a third grade education. My mother had a high school education. They were committed to my brother and myself not being in that level of education. My brother went on to become president of one of the largest insurance companies in the world.
Wow.
He went to Stanford. Mother was the major motivation there, and Dad just said, okay.
That's amazing. What sons. So let me ask you, right off the bat, it seems like you started educating. I mean, was that some of us may look at a little loop or a little need and fill it, but education, I mean, you started PCC and the research clinical report. I mean, how did that happen so quickly in your career?
Well, I did 2 graduate programs after dental school, and I was in the Vietnam fracas, so I learned more there than the dental school by far. And I found out what I did not know and how I had to integrate with other parts of medicine, which, being from Penn, which is very integrated that way.
Yep.
And in that first graduate program, which was University of Washington, I was asked to help start University of Kentucky. I started 3 schools in my career, but Kentucky was the first one. And Al Morris, I bet you know that name. He was the dean. I was 28. He was about 35. We were the youngest faculty that ever happened. And we looked at curricula and we said, what did you learn in school that you never used? And what didn't you learn in school that you wanted the first day? And we built a curriculum, a vertical curriculum, where when you learned that, you injected your next door neighbor that day. It wasn't 2 years later when you forgot everything about it.
Exactly.
So it was kind of
A lot of practical learning, huh?
yeah, it was. That stimulated me, and it just continued to develop. I finally decided we needed more eyeball-to-eyeball dental education and not just a bunch of slides flashing through looking how good I am.
Well, I
Yeah.
want to tell you something. I started a product called Snap-on Smile.
Yeah,
I
yeah.
invented that, right? And when CR came out with its report, and we did whatever needs to be done with CR, and we spent the time and effort, and it came out with 87% of the doctors that used it said they would use it a second time. That was probably the biggest line in my presentation to doctors. CR really spanned a lot of interesting, really prominent products and tidbits. I mean, that was just some fascinating publication. I don't see it as much. I mean, is it still around? Is it?
We're in 101 countries. We're in several languages. Yeah,
Do you mail it? Because I see it online sometimes. Is it?
it's online primarily. They still get a paper copy of it.
Wow, amazing. I mean, what gaps are you seeing now? I mean, if you go to a dental school, you started 3 dental schools. I see some gaps in dentistry and the education. What do you see? I mean, they've gone through a couple of tough years with COVID and
Wow. Well, I see a couple of things, Mark. First of all, they need a mini MBA while they're in dental school because they are clueless. And anybody with any financial knowledge runs right over them. So that is number one. Number two, schools are judged now as to which is the best school in the country and which is the best school internationally, primarily by how many federal grants they get. And that kind of frustrates me because they get out, now there's 70 schools, as you know, going on more than that. I see many of them judged just on the basis, oh, we got $24 million last year. Well, so what? Can the kids use their hands and their brain together or not when they get out? That's the primary thing. So I see 2 things, and they're pretty heavy. I'd like to have some business acumen as they get out, and I would like them to be able to do at least the basic things. We run hands-on courses right in this building where I am, and I find many of the young dentists have very meager knowledge coming out. The course we just ran last week, I had, I would say almost half of them were out of school only up to 5 years. And the difference among those kids was unbelievable. Some of them were pretty good. Others, you had to show them up with the burr and the handpiece.
Right.
And we need more clinical.
I agree. And also, I find treatment planning, which is the roadmap,
Yeah, I agree completely.
you know, how you communicate with the patient. I mean, I think the understanding how the occlusion works with, you know, how it works with the restoration, how excursions work with the mouth. I think there's a lack there of common treatment planning or really long-term treatment planning and then communicating it. That's what I see as a big miss. And I love the business acumen because so many dentists don't know what they're doing and they end up in a bad situation.
No idea. Yeah, the course I was just planning before I got on with you today does exactly that. They're small hands-on groups, and we get 30 or so in the group, and we divide them out. They bring in cases that they're concerned about. Some of the mentors who teach with me, I have 40 of them that come from all over North America.
Amazing.
Charged to me, they're just interested in education in the cop. Yeah. And we divide them into groups of 6 or 7. They meet with one of those mentors, and then the head mentor puts it to the whole group, and we finally get a treatment plan. Yeah.
Well, then let me tell you and everyone else about it, of course, from Dr. Gordon Christensen. Just happenstance, I was having breakfast this weekend with a dentist talking about maybe a business, maybe he was looking for a job, whatever it was. And he turns to me and he goes, I never told him he's seen my podcast. He has seen it, but he didn't know you were coming on. And he said, did you ever see Gordon Christensen lecture? I said, I did years ago. He said, I was in Fort Lauderdale 2 weeks ago.
Oh, yeah.
Right? A V-Day course or something you did?
Yeah.
He told me he left like this. He was blown away, Doc. He was it's just amazing.
I did over 80 courses last year here and there around the world.
That's incredible. So I want to bring something in that you didn't speak about, but you wrote. I've read a couple of articles of yours because I'm a learned guy of dentistry.
Yeah.
You compared a very interesting article from a 3-unit bridge to a single tooth implant in October of last year. I believe it was. My question to you is, if you needed a single tooth implant or a 3-unit bridge, it seemed like you were favoring the less invasive 3-unit bridge. But I know you went through a lot of factors and time prevents us from diving into that, but I'm just curious to know your thoughts on that.
Okay, I have some thoughts. I've been placing and restoring implants. I'm a surgical prosthodontist.
Amazing.
I do everything. And that's for 40 years. My first course was from Marc himself, and I thought implants would replace teeth. I really did for the first few years, as they were running 95%. And now, as you know, by 9.5 years, 46% of them have peri-implantitis or other vague things.
Right.
So when I look at somebody with crummy bone, or look at somebody who has teeth that are pretty well broken down and almost impossible to restore, I'm thinking implant. But I'm not nearly as aggressive as I was years ago about implants. I still do implants routinely, and I find them very, very admirable. However, I have one implant right there. And just today, I went out and I had a lunch that had some hard meat in it. And I was chewing on both sides. This is today. And this came to me so strongly after I had eaten that hard piece of meat. The teeth, as you would expect, intruded about 100 microns. What did the implant do? It stuck up like a pillar in the middle of the lake. And for about 20 minutes, that's the only thing I could hit. That was it. Implants are great, but I consider them at this particular point not the first alternative, the last alternative when nothing else can be done.
Very interesting. Amazing. I'm so happy I asked that. You've witnessed, really, I'm really happy. It was personal because I read it, and we're going to get into my concept of a super generalist. And I think I'm talking to one of the first, if not the first, surgical prosto that understands what a dentist who could deliver all the modalities of implants and surgical and extractions and full mouth rehab, occlusion, aesthetics. That's what it's about. But you've witnessed significant changes in materials, technology, workflows. What advancements have truly were about patient comfort, patient experience? What has really helped the patient care in your eyes?
The eclectic orientation of a typical general dentist, but when that general dentist gets to the point where he or she feels uncomfortable, the resource of the 25,000 or so specialists that we have. So I think it's someone who has enough experience and knowledge about the whole variety of things. As an example, endo. Endo's great, but on the other hand, every day, I feel that even a specialist in any one of the 12 specialties now should have some knowledge of all the other specialties and general practice. Eclectic is the word. Thought days. I've had numerous endodontists working in the building I have, and most of them would have to take off. After about 3 weeks, they'd go take a few days off because it's the same old.
Right.
but broadening out. In fact, I was doing it. I have a few endos in my own mouth, and the endodontist I was with recently, I had one root he couldn't find the MB2 in. And he said, looks like you may need a root amp. And I said, well, go ahead and do it. Oh, I don't do that. And I thought, well, what does he do? Find hole, put rubber in hole? Is that it? I don't know. I think we're broad. We have to have broad orientation to stay.
Exactly. I love that. Broad orientation.
Average general dentist burns out, Mark, at 25 years. If they have not stayed abreast of all the new things going on, same old, same old.
I mean, that is a question I was going to ask later on, but I mean, what keeps you? I mean, is it the love of the profession? I mean, what keeps you going? My wife is yelling at me. I want to spend more time traveling. I like doing what I'm doing. I to shows.
I'm traveling. Yeah. Going to Hinman tomorrow morning, you see.
What keeps this man going?
Well, I come in every morning, and of course, I've got 40 full-time employees working in the research group. And I think, what's new today? What don't I know? Where can I find out what I don't know? Who's teaching what I don't know? And then go do it. And that's what's kept me alive. I'm happy to come in Monday morning. I know a lot of dentists who aren't. They'd rather real estate or go out and go do golf.
That's not you. I have a question for you. We talked about technology. Something I've got to pick the brain of probably the top educator in dentistry. AI, Pearl, Overjet, all these companies coming out. A lot of people are using them to educate dentists.
Mm-hmm.
I imagine, just curious, do you think that is a component that's really valuable in the future? I think it has value to patient care, patient presentation, but do you think as an educator, it should be that?
Yes. I go on AI daily several times. One or the other outfits that they're now promoting it. We have yet to have a really good dental one. They're developing. We've been asked to develop it, but I'm not sure I'm into that much detail. I find at this particular point, I'm an old statistician. I taught statistics at the graduate level for a while. And all AI is a big meta-analysis. In other words, you get all these things together in the universe, and it's squished down to that thing. And that thing is the mean, or if you want to make it an average, either one. And in doing so, are you average? No. Am I average? No. So you have to have HI with AI before you can make a decision.
Beautiful.
All AI does is give you a dang average.
100%. Exactly. But
that's an enormous help, though.
I love that. It is an enormous help. And I want to get you, done in a normal time because I could talk to you for hours. But I really want to dive in to the business end.
Okay.
You mentioned it in one of the things, just right off the bat, we need more acumen in dentistry. But I mean, corporate dentistry is here to stay.
Mm.
And you've seen the transformation from some dentists owning a few practices to Heartland and PE firms and Wall Street owning thousands.
Yes.
What's your first inclination? How do you feel about it?
At first, I was negative.
Right.
Many years ago. Then, as I saw it develop, I could see very clearly that for the young dentist, with the multiples of dentists we have now, at 202,000 dentists in the U.S., and 70 schools and others coming, it's going to be more and more and more saturated. Yes, there are a few areas that need a few dentists, but you have to count the cows and pigs, too, to get there. And I think sometimes they're doing that too much. I have, my brother had one of his sons who went into corporate early on. We have quite a few dentists in the family and physicians and you name it, help people.
Right.
And at that particular point, there were 100 corporates, majors, and the top three, and Heartland and Pacific.
And Carolina.
Well, they do. They learned very rapidly that they had to put the patient first because that was not happening. They saw a different kid every time, and 60% of the corporate dentists at one time were up to school out of 5 years. And that just didn't work with some patients. They wanted to see the same guy or girl each time they came in. I've written a few articles on it that are available in the literature if those of you listening want to look them up. I feel it's good and it's bad. It's good for the young person getting out who gets a little experience. That one son of my brother's learned Starak. He stayed, I can't remember what it was. It was 18 months, I think. He left, and he has 2 practices now in Reno, Nevada, and he's doing very, very well. So that started him out with 400,000 in debt. I found a few right now at $1 million in debt.
Wow.
Coming out of school, I don't know what the heck they think. But and then there's some middle-agers who hate malpractice. They hate having to hire and fire, and for them it's good too. So there's some good aspects to it.
Absolutely. Not everybody's a rainmaker.
Yeah,
And you know what I mean? Not everybody goes into their office and sells these rehab cases. But I want to know, do you think in 5, 10 years, I mean, you'll still be cranking at the chair, that's for sure. And I'll be somewhere hopefully on a boat. But let's say you're still cranking. Do you think Dr. Main Street, the solo doc in a box, has a role here? I mean, some areas just drain the economy of dentistry in their own area by opening them up, rather than really corporate.
I was in I had a group it was about 500, and it was young dentists, all of whom did not want to practice. They wanted to own practices.
Correct.
And some of the larger corporates were there to give them some guidance and so forth. It's growing, and it's needs a real crystal ball to figure that out. But I see, as far as I can tell, right now there are 50%, almost 55% that are either corporate or group, and they're 2 different animals, as you know.
Right, absolutely. And I know both.
Yeah,
I'm very affiliated with what I see now is dental partnership organizations.
yeah,
That they take a percentage where the doctor is very involved.
right,
And
right.
I want to say that, to your point that you just made, I don't want to go over it without mentioning it. It's that somebody went to a group, learned how to run a business, right? I mean, they utilized the group and then they went and opened up their own business and they're doing crazy well. And then they're going to sell it down the road, maybe when they're all done, to a group. So use the groups to your liking, educate, or to your point, the middle age that can't sell, maybe wants to go home at 4 o'clock, doesn't want to rain make. Perfect. So there is some, there is good stuff to it.
There's a place for it. There are those who prognosticate how accurate they may be. I don't know, but they're saying probably 75% eventually will be corporate or group.
Yeah.
But a sizable part of that, more than today, will be corporate.
And I personally think that if we can if the corporates keep gaining the respect,
Which they still need.
they still need to do, but some groups, they do, but eventually it's all about the dollar. And they're going to, the doctors, that's what it's about. So we know that. And you're somebody that has seen this for a long time. Like you say, you got to determine the groups from the guys who have just a few practices, and that's something. But let's just, I want to bring it to a close, but I'll be remiss without talking about your legacy and what you think about the future of dentistry. I mean, you're still out there educating docs. You have to be relevant. You are relevant, but you have to be updated on all the new
Every year.
every year. How is it that somebody like yourself is still appealing to all kinds of dentists? I mean, I'm just amazed by that. I really am.
In our own group here, we have everything from 5-minute courses to 1-hour courses to 3-hour courses to 2-day courses. And it's changed markedly over the last few years. We have to have virtual, although I am a PhD psychologist as well as a dentist. Most don't know that. And the psych literature is filled with negative about virtual. But we have to have virtual because some of them don't want to get out of their bed. They want to sit there and just watch something. So I'm positive about the future. We have 3 major conditions. You know it as well as I. We have caries that we overtreat. They'll do a pock mark. And I'm seeing some schools teaching even a cracked tooth needs a crown now, which is absurd. I mean, a cracked tooth asymptomatic. I see the gross need for more clinical education so they can understand treatment plan, the complexity of the thing. And I'm positive that much of it will have to be virtual. When I had one session, it's not been long ago, when they told me they had 5,000 dentists in it. Now, we do enough virtual for me to know that that's false. I mean, that 5,000 may have said they're going to come, then you end up with several hundred. You know that. I see the need for virtual. I see the need for much more need for hands-on. When we get out of school, there are over 100 procedures in dentistry, more than any other specialty in medicine. And we're blessed because with all those procedures, you're never bored. So
Exactly. Exactly. And that's somebody like yourself who did surgery and then did reconstruction. I mean, what was boring about your day? You never know what's walking in, right? It's amazing.
every day is different. Every day is different. And every patient's different, obviously. No, I'm very optimistic about the future. But the three things we treat, caries we overtreat,
Right.
area we know about, you'd be amazed, Mark. And in courses, let's say I got 500 or 600 in a course. And I'll ask, how many of you have done 10 periodontal surgeries in the last year? I'll have 3 or 4 out of
It's a lost art. It's now implants or nothing. I mean,
if we did not have hygienists, we'd have no perio at all.
that's right.
And then we got occlusion, which is a lost cause. And that's one of my favorite things. Now with zirconia crowns banging on one another, it's amazing any implant can handle it. I told you about
It certainly increased to endo. I mean, non-vital teeth are common, but I will say that that's so true. But I want to know if Dr. Gordon Christensen wanted to hear somebody in dentistry speak or learn from. Is there somebody out there? Is there? I mean, I obviously think of some other people that are up on that Mount Rushmore with you, but are there people or somebody that you really
coming along.
know? Anybody? I'm just curious.
Buddy, oh, well, we have tried in vain to find someone eclectic enough to run this organization.
I was going to ask you that.
Very, very few. I could list probably a half dozen who know a little bit about everything, but concentrate on one or two things. The most are just happy to do what brings a few dollars and stop right there. I don't see the eclectic dentistry that I saw in the past. Few of my 40 mentors, I have probably 10 who've been doing implants, ortho, sleep appliances, the whole variety of things that keep them turned on. And then I see others who are just happy to go and then go out and play golf later in the day.
That's right. You don't like golf, do you?
Well, I tried it when I was a kid, Dennis.
It's humbling. It's humbling, good. I hope it's not the last, but it's probably coming down to the last question. And I want to thank you, Dr. Christensen. This has been just looking at you. I'm amazed. I'm really talking to you. I've read so many of your articles, but I mean, I kind of want to know, how does somebody like you? I'm in the business of group dentistry. Our biggest thing is taking elderly, aging dentists and having a succession plan. I call it procedural matching, where I'm going to match these associates to the procedures the dentist may not be doing. Endo, surgical extractions, maybe Invisalign or clear aligners or an implant, and if the doctor's just, but how does somebody like Dr. Gordon Christensen, you alluded to it with the CR, but how do you do it with your practice and your massive educational platforms? How did somebody develop a succession plan?
I have several people right now who could walk in and do most of what I'm doing. And I'm not going anywhere. I'm healthy. My wife and I go to Mayo every year, and we get what's called an executive health exam. It's a 3-day exam. They kicked me out at 1 day this year because I had nothing wrong with me.
Bless you. That's by the way, congratulations to your wife, Rella Christensen, on the nomination for the Denobi Awards.
Oh,
I was on that list. We have one thing in common, your wife and I.
was it?
We both didn't win it. So I would tell Rella we're both losers, but she's a winner in our book, so it's all good.
Well, yeah, he knows more about zirconium than any human on the earth. We've been on it for 30 years now, as it was evolving through that thing.
Well,
Well, I think as I look at the future,
yeah.
I would send a son or a daughter into dentistry in one heartbeat. I have 8 grandchildren and 14 great-grandchildren, and some of the grandchildren are still finding themselves, and they're in their early 30s.
Right.
And I have one right now in a 4-year naturopathic MD because he looked at a lot of the other conventional MDs.
My kind of guy.
Well, seriously, I'll tell you a story. I know we got to quit this.
No, we got to.
My wife had a sciatic nerve problem, which is very common, as you know.
Yes.
And the first time she had it, she got to the point where she couldn't walk. We had to stick her in a wheelchair. We were right in the middle of a course in Las Vegas, huge group, and she was in a wheelchair. And one of the guys in the audience was also an acupuncturist. He said, "May I take her for a minute and see what we can do?" They wheeled her out in the wheelchair. She walked back in after 3 or 4 needles were stuck in her head. This grandson who's in a naturopathic one now saw that. He also saw the second time she got it, 13 years later, all the MDs wanted to slash her back and stabilize it. Well, we got her to acupuncturists, we got her to physical therapists, several orthopedic surgeons, and then I finally, none of them really turned me on. We got her to a DO,
Yeah.
Dr. Osteopathy, and he tactfully and quietly said, "I think there's a better place to inject that steroid." She walked out after it was injected. All the rest had failed. We need to get Eastern and Western medicine.
I may want that number, by the way. And I may travel, but I want to say something. I meant it. I have a niece who does that type of Eastern medicine, does acupuncture in New York City, has an amazing practice, and it helps. And it helps.
This son, this grandson, he's going into his 3rd year in this 4-year MD, naturopathic MD degree, and he and his wife, very bright young woman with a master's degree, they want to start a clinic for disadvantaged youth who are on drugs, and I know it'll be successful.
It's great. I'm sure they're a Christensen. They've got to be. They've got to be. If not, you'll educate them. Dr. Gordon Christensen, what an honor. And please come back. And if anything's exciting, I'm going to see you at some of the shows, hopefully, and I'm going to give you a big man hug because this was fantastic. And thank you so much for your insight. Your pearls are wonderful. Thank you again. I really appreciate your time. Once again,
keep up your program. You're an excellent host, and your questions were better than any I've ever had before.
Thank you so much, Doc. It means the world. It really does. And I got to tell you, you really are a pillar for so many. I was all day I'm saying, I wonder how many people he knows. Does he have any idea how many guys like me or gals like me are out there just...
It's embarrassing to me because I'll go somewhere and, oh, hello, and I wonder who that is. It's too many. But
it's amazing. And thank you. Kudos. I'll see you on the other side. Thank you. I really appreciate you.
Keep Mark.
Great job.
Yes. Okay.
So, Dr. Christensen just left. I wanted to talk to you about, how much we've learned from him in the past, but just the last 30, 35 minutes has been inspiring. The man is, we don't have to talk about his age. We all know that he's up there, but you wouldn't know it from his passion for the field of dentistry. Obviously, having something like dentistry has propelled this man to continue working, continue educating. What I've taken away is that through changes, he's really modified his beliefs, his focus, but he has never left that the first premise in his practice, the first premise in the way he goes about his life in dentistry is patients first. Practice experience, how patients are coming in and perceiving and doing the right thing. As he said, right, faster, easier, cheaper, better. And if you could do that for your patients, that's what you do. And I think we learned a lot today. We learned that super generalists are here to stay. And they were here for many, many, many years. Dr. Christensen mentioned that he's a certified prosthodontist, board certified prosthodontist, but he also is a surgeon, surgical prosthodontist. He does clear aligners. He dabbled in root canals. So this is the point I'm making, is when you have Mount Rushmore type people speaking about the things that we're preaching here, about getting yourself well-rounded, we both agree that being that well-rounded super generalist brings you to be the best treatment planner comprehensively you could be. Like Dr. Christensen alluded to, occlusion, amazing, caries control. His point there was it's over-diagnosed. That's somebody that's seen a lot of caries. So, I think it's become more of a business dentistry, but I have a saying when it comes to that. And it's 32 teeth, gums, and bone. If we can't find something pathologic to work on, we suck. We have to find something else. So what he's saying is caries is diagnosed a little too heavily. Yeah, maybe it is. Maybe AI will slow that down. But I was blown away by Dr. Christensen and his passion for teaching, educating, and progressing the field of dentistry. We should all be giving him a big thanks. So when you see him next at his Hinman or something else, first of all, Dr. Christensen, thank you for your service in Vietnam. Secondly, go over to him. Just say thank you. Because there are certain people that have really set the groundwork for all of us to understand occlusion with proper restorations. Understand how to treat and plan. Don't overdiagnose. Care for our patients' well-being and still make a phenomenal living. The point is, I think we're seeing really unbelievable people in this field. And I am so excited to talk to them. So excited to bring it out. And I won't stop because there are so many more. And if you're that type of person, if you're a dentist that has done something in this field that just stands out, doesn't have to be Gordon, doesn't have to be like Dr. Christensen, but I want to know about it. I want to hear about it. Education is so important, and there's so many ways to do it. But anyway, I love this, and I hope you enjoy it. Thank you so much for listening. This was Dr. Marc Liechtung on Dentistry Beyond the Numbers. See you next time.